Welcome to the Indiana University Fundamentals of Microsurgery video series. The Fundamentals of Microsurgery, FMS, was developed within the Division of Plastic and Reconstructive Surgery by Drs. Danforth, Hassanine, and Lester. FMS is a competency-based curriculum designed to implement basic technical skills prior to performing microsurgical anastomoses in the operating room. There are 5 tasks performed for specific skill acquisition. This video discusses Task 5, Synthetic Vessel Anastomosis, performed within a depth block to mimic a deep cavity. The goals for Task 5 are to maintain competence previously gained skills while performing an anastomosis within a depth block. The previously mastered skills are suture handling, knot tying, double Acland clamp placement, bisecting suture placement at 180 degrees, even suture placement along front and back wall, full thickness bites, and no back wall suture placement. Our program prefers tenting the vessel wall with intubation with jeweler forceps using the non-dominant hand. The jeweler forceps tips should be slightly opened, and this opening distance should be consistent throughout suture placement. The foam background and synthetic vessel are placed within a depth block. Each 9/0 suture is placed following the curve of the needle through the controlled spread of jeweler forceps. The needle is, and grasped, rotating the needle driver 180 degrees tip down. The curve of the needle is followed, and the vessel should not be elevated from the background. Following the curve of the needle can be difficult with the increased angle of needle driver and forceps. The trainee must focus on rolling the instruments between their fingers to achieve the desired effect. The suture is advanced through the vessel wall, setting up the C-loop and suture tail. The C-loop should be 2 to 3 times the length of the suture tail. An ideal length of the suture tail is the distance between the anastomosis and the Acland clamp. The needle driver is used to grasp the C-loop, and the suture is tied with jeweler grasping the suture tail. Our program also prefers surgeons knot for the initial knot of bisecting 180-degree sutures. 3 knots are tied, and the suture ends are trimmed with micro-scissors. The placement of the second bisecting 180-degree suture is the most critical suture placement for spacing of anastomotic sutures. 3 front wall sutures are placed, and the Acland clamp is then flipped to place 3 back wall sutures. Each suture should be placed evenly along the anastomosis with appropriate spacing. Evaluation of the anastomosis should be performed with the Stanford Microsurgical and Resident Training (SMART) scale. The task should be completed in 12 minutes, and the average SMART scale score should be 4.0. Critical errors of vessel elevation, wide opening of jeweler forceps tips, and not following curve of needle should be avoided. Please contact the Indiana University Division of Plastic and Reconstructive Surgery for questions.